This is The Weekly on ClickOrlando.com with Justin Warmoth.
Good morning, I'm Justin Warmoth. COVID cases, hospitalizations, and deaths are all spiking as the Delta variant sweeps across the nation. The overwhelming majority of people who have severe symptoms, 97%, are unvaccinated. This morning, Seminole County Medical Director Dr. Todd Husty is here to explain why this strain is so contagious and how the county is working to get more people protected. Dr. Husty, thanks for joining us this morning.
Thanks for having me, and I really mean that.
Appreciate it. Let's just start with the current situation, COVID situation in Seminole County. What does it look like?
Right now, the COVID situation is going directly in the wrong direction, and pretty rapidly, more rapidly than I actually even thought it was going to. This thing is so predictable. I mean, it's a virus. It's not fancy. It's not making up new rules as it goes along. You can't predict everything that happens with this virus. So what we do, we got really comfortable. A lot of vaccinations out there, not enough, but a lot. Then we started letting our guard down. Mm-hmm. Can you predict what's going to happen next? Well, heck yeah.
Yeah, you along with other health professionals predicted that there would be a rise in cases once mask mandates were lifted. But that was really before the Delta variant became the dominant strain. So I'm curious how the Delta variant has accelerated the pandemic.
Well, so what we do know about viruses and variants, viruses do mutate. Every organism on Earth can mutate, but it usually mutates when it replicates, when it's creating more of itself. And so, we have 3 or 4 opportunities in a lifetime to create a mutation that we as humans, but these things are multiplying thousands and tens of thousands of times in each individual. Just think about the opportunity for a mutation to exist. Most mutations in life cycles are bad ones and they die, but some of them accidentally cause a mutation that creates something that helps the organism improve its chances of staying on Earth. And what this thing did, and what all these mutations, we heard from the UK variant that it transmitted a little easier to people. Well, the Delta variant transmits much easier to people. Its accidental mutation helped it out. It helped it do what its only goal is, and that's to get from person to person to person to person and replicate itself. It's the only goal a virus has. Mm-hmm. And the Delta variant is much more efficient at that, which is a bummer.
Yeah. Are you seeing on top of case counts going way up, how do hospitalizations and deaths, what do those look like currently?
So, I've been saying at the beginning of all this, people were looking at how many cases, trying to keep an eye on that sort of. I think we fine-tuned the how many cases down to, like, let's look for the last 7 days. What's the trend? Mm-hmm. And that helps you to some extent until you have so many that what's the next trend? Well, some people were looking at positivity rate, but when there's not a lot of illness, only the worried people go to get tested. Oh, so the positivity rate's kind of low because they're not really sick people. Right now, the positivity rate skyrocketed. Why? Because sick people were going to get tested. All of a sudden, we know it's kind of coming back and I feel sick. I better go get tested. Mm-hmm. So the positivity rate skyrockets. That doesn't have a lot of meaning. It has sort of a direction, but not a lot of meaning. What we really decided was when we're in the middle of a surge, what do we really want to watch? Hospitalizations. Mm-hmm. And hospitalizations have gone up. They've more than doubled. They've almost tripled. So what does that tell you? It tells you a lot. It tells you that not only are people getting ill, but they're also getting sick enough to be hospitalized. And that's the scary part.
How many of whom are unvaccinated?
Well, almost all of them are unvaccinated, which is interesting because if you look at the who are the unvaccinated, who are getting COVID are mainly the unvaccinated, which is mainly the, that the older teenagers to the 45-year-olds. Oh, but the hospitalizations are up. Guess what? If all those people in those age groups who feel immune, you're not immune. Your chance of getting serious disease is lower, but it's not low enough to keep a bunch of those people in those age groups out of the hospitals, because the age groups are in the hospitals. I know my son is taking care of two people without other conditions. One's 23 and is waiting for a lung transplant because of COVID. One's 27 on bypass machine, basically trying to keep him alive. And so you look at, and that's not unusual. We're hearing it all over the country. It's hitting younger people with fairly serious disease. Not all of them. I'm not going to lie and I don't want to scare people.
Right.
I'm just trying to show the truth. And the truth is, just because you're younger doesn't mean you're not going to end up in the hospital. It doesn't work that way.
I mean, we know that unvaccinated people are most at risk. And with the stories, as you just shared, it seems like it's just not registering for the people who are not vaccinated. There are a number of issues why. So how is Seminole County working to get more people vaccinated? And I don't know if convince is the right word, but it takes some convincing and some push.
So, I'm really proud of the fact that the folks that I've worked with in Seminole County, because I think we've taken a good, hard look all through this whole COVID thing and come up with good ideas about what to do and what not to do. Our sheriff said we're not going to arrest our way out of COVID, just like he said we're not going to arrest our way out of the opioid crisis. It was his mantra, and he's right. So we all agreed. So we went, you know what? It's education. Education is going to win the day. That's why when I said I really mean that, thank you for having me on, it's because things like this is how we educate the public. So thank you. But so number one is education, general education. I think that as people see that there's been hundreds of millions of doses of vaccines, I mean, the reality is, the science is that it hasn't caused a lot of problems. Vaccines can cause a little problem here and there, but a lot less problems than COVID causes. So, I mean, it's sort of like in medicine, we try to do the balance thing, the risk versus benefit. Well, the risk of the vaccine is so small, the risk of the benefit of not getting COVID is so large, it's a no-brainer. To me, it's a no-brainer as a scientist, and to get people to follow that science. So we are pushing harder in that direction. We're pushing more on social media. We are constantly trying to doing pop-ups and doing vaccine sites at places, at community centers, etc. We're going to go around with our own firefighters, because not all of our firefighters and other people and their families have gotten vaccinated. But I think if we weigh out, this darn thing is so predictable. The science is so clear. And part of that science is masking, social distancing. The other part of the science is vaccines. And well, there's another part, which is the antibody infusion should you get sick. And so there's science to this. And unfortunately, the end of that science is a mutation so bad that we have to start over again.
And the Delta variant is also impacting children. Coming up, Dr. Husty will share some advice he has for parents as we approach the new school year. Stay with us.
This is The Weekly on ClickOrlando.com with Justin Warmoth.
Welcome back. After declining for 6 months, coronavirus cases are once again on the rise thanks to the Delta variant. Health officials calling the current situation a pandemic of the unvaccinated. But if you are vaccinated, how worried should you be? And what does this all mean for kids with the school year right around the corner? Here's Seminole County Medical Director, Dr. Todd Husty. Overwhelming information you'll read on vaccines and COVID will point you into the direction of getting vaccinated to protect yourself and others around you. Yet, there are still misconceptions that people run with. What are the most common that you see?
I think the most common is they cite that this is emergency use only. So, or the vaccine is only for emergency use. I again, if you follow how the science works behind getting full FDA approval, I mean, yeah, it requires a different set of information,
Mhm.
but if you look at what they did to try to, it takes to get a new vaccine out there would take 3, 4, 5 years.
Mhm.
We didn't have 3, 4, or 5 years. What we had, so usually what they would do is they'll test 3,000 doses on 3,000 people, or 6,000 doses on 3,000 people and see how it does. See if they grow a third eye or something, see if they have bad outcomes.
Mhm.
And so, and then if it's okay, then they go, well, let's try another group. And then they try another group, and then they try another group, and they start combining the data together and looking at it all. Well, that can take years. So what they did instead is Pfizer and Moderna said, let's do 35,000 people at once, and just bam. And we didn't see a lot of bad outcomes. So really, this is a numbers game. It's all about probabilities of this, probabilities of bad things, probabilities of good results. We've done over 100 million of each in the world. Are we convinced yet? I mean, really, what does it take you to be convinced that it's not some sort of conspiracy, and that because it's emergency use only, it's emergency use because it had to be,
Right.
not because anybody was trying to hide things. It just had to be emergency use. That's all. I mean, it's pretty simple.
Yeah, I hear you. I hear you. And it's tough. I know a lot of families dealing with that dynamic of someone in their family not wanting to get the vaccine, not wanting their kids to get vaccinated. It's a tough situation, and all you can do is educate and hope that they make the right decision. But I'm curious, have we reached President Biden's goal of getting 70% of the population vaccinated by the 4th of July? I'm just curious what our situation would look like if that happened.
Well, we're not exactly sure. I mean, are we sure we know what would happen? No, it's a new virus, but we have some pretty good idea. It is just a virus, and you can make some predictions. 70% vaccinated, if you include the people who actually had the disease and have immunity from that probably puts us in the 80% range. Now we're talking about herd immunity. Prior to that, you're really not talking herd immunity. You're talking about bob and weave. Doc, here comes another one. It's like but herd immunity is good because not only does it keep the thing down and decrease the chance of bad mutations, which is important in all this, but also it's easier to keep your arms around the people that have the disease, and you can provide them care, keep them from having to go to their grocery store. But when you have thousands of people in the county that have it, you can't do that forever. You just can't keep up.
Yeah.
You got 10 people in the county, we can help. I mean, we can help take care of that.
Yeah, much more manageable, especially after a year and a half of dealing with COVID and how stretched thin so many people are when it comes to treating people for the virus. So, school starts in just a few weeks, and a lot of people are urging younger folks to get vaccinated who are eligible. Are we seeing a spike in younger people getting vaccinated ahead of school?
So yes, I'll answer that. Yes, I don't know the exact numbers, but
Yeah.
I've heard that we're getting not only the kids vaccinated, at 12 and up, but their parents. The parents have been riding the fence about, I'm not sure we need this vaccine. I'm not sure I trust the vaccine. And all I can do is, it's kind of interesting is that if this were smallpox, we'd all go get our smallpox vaccine. If it killed more people, if it was more deadly, measles, mumps, rubella. We've forgotten how deadly measles, mumps, rubella is. You look at some African countries that are having a hard time getting MMR shots for their kids, and they're having measles outbreaks that are killing kids. We've forgotten how kids die but this is not as bad in kids. So we kind of ride the fence like, am I sure? It's just another vaccine.
Right.
I mean, the way I look at it, like and it may not help the kids as much, but it helps their parents more, and it helps their parents' more, their grandparents. So it that's what this is for, and trying to limit the ability of this darn thing to survive. It needs a pool of people to go swimming with.
Yeah.
And if we decrease the pool size, it decreases the amount of virus, and it decreases the chance of it getting way out of hand again. Without decreasing the pool size, including kids, including social distancing and masking, unfortunately, I don't know. It's just going to stick around, and it'll mutate enough at some point that we're going to have a different vaccine.
So when school starts in a few weeks, do you think kids should wear a mask if they're not vaccinated? Because I know Seminole County has the recommendation of making it optional.
I talked to a teacher the other night at dinner who teaches reading. Well, you kind of need to see how I form the words. That you can see my lips and tongue when I say the, and you can see it. So no, she needs to have her mask off. It's playing the odds again. Got a bunch of vaccinated people, got some unvaccinated. The unvaccinated should probably wear masks, but maybe even the vaccinated, because they run the risk that if you can't social distance, get the kids outside, take those masks off, have a good time. But inside, sitting next to each other, or etc. Why not? It really doesn't hurt them unless they need to speak, or you get them in the front of the room to give a report. It's fine. Have them take their mask off. It's all about the odds of transmission.
When we have these local spikes in cases and hospitalizations, and the virus runs rampant, do we see vaccine rates go up at all?
Oh yeah. So I stopped by back when we were open in the Oviedo Mall. I'd stop by every now and then, especially later on, and there were still people coming in to get vaccinated. And I just asked, so is this your second shot or first? No, this is my first shot. Why didn't you do it before? I was just wimping out. I didn't feel comfortable, but now I don't feel comfortable not doing it. You know what I mean? And so because there was a little spike going on at the time, and so there you go.
Yeah.
Now we have a bigger spike. Yeah, I think it makes people pay attention. I think it makes them. Hopefully, we all question our opinions and our positions in life. I mean, we should question. I mean, good doctors question themselves. Good professionals question them. Good people question themselves as to whether we're doing the right thing or not. We should all question ourselves. And I think when you do that and you look at the science, the answer is, you know what? This is a virus that's very predictable. And we have a vaccine that's very predictable. And we can stop this thing. You can predict that too, but we all need to do the right thing. And we probably need to continue to wear masks in places we can't social distance.
So bottom line, we may be done with the coronavirus, but the coronavirus is not done with us. To find a list of vaccine locations near you, just head to clickorlando.com. I'm Justin Warmoth. Hope you have a great Sunday.